and discrimination. I think it's really hard for people to understand who haven't been through this kind of experience to really know what it's like. But mental health summary statements, a lot of it really is revolving around how can mental health professionals assist people in gaining access to treatment. And that's really what it's zeroed in on. And there is an explicit statement stating that conversion therapy is not something that we should be in the business of, and that we should not be in the business of saying that people are required to engage in psychotherapy to access gender-affirming care. So I think WPATH would prefer that we would be using ICD, but I think a lot of us are using DSM. But that diagnosis is required to access treatment. So I'm going to just dive into the whole issue about psychotherapy. It's quite clear that as a mental health professional, I have a bias. I kind of think that I'm helpful. I think it's helpful if people come to talk to me. But some of my clients find that they like to talk to me for a brief period of time, and they've had enough. I need to respect that. But some people think it's concerning, and some people worry when they have a client that doesn't want to see them, that doesn't want to see much of them. Why did the standards of care really make a more definitive shift? And I think there was hints prior. One is access issues. This is a global initiative. We can't say that every trans person has access to an actual gender-affirming, gender-literate therapist, or that they can afford it. This is a big issue. It's a big issue in Canada, although we proclaim we have universal health care. It's universal health care with a big asterisk, because it seems like mental health kind of falls off the wagon, along with a lot of other things. And we can say that about a number of gender-affirming treatments, multidisciplinary ones that are not, depending on which province you're in and what government got elected. Because we have provincial authority and for people who are not from Canada, so the provinces all do their own thing. We have people moving interprovincially to get access to care, depending on what the word is out about what's available. Sad but true. The second thing is stigma. Psychotherapy, suggesting that you need psychotherapy for being gender diverse is implying that there's a mental disorder, and there's the implication about the gatekeeping that used to exist. However, we do know that mental health providers can play an important role in walking people through in a way that I think it's harder for the time-starved other clinicians. I think we're used to, or should be used to, trying to give people time and space to think and talk about what they're going through.